Hey everyone, Jim here from Village Local. Thanks for joining us for another conversation. And in today's session, I'm joined by Jessie Hawk, who's the General Manager of Communicate Speech Pathology. So Jessie, welcome to the segment.
Thank you for having me.
Jessie, you and I have been chatting for a couple of weeks now, and we started the conversation just because it was identified in our community that a lot of people are post or had an acute incident and experiencing communication challenges with their friends, with their family. And I think the one example that I'm specifically thinking of was a gentleman who reached out to us expressing that he recently had a stroke and and he is having trouble communicating. And over the years or months, I think it was, he's finding he's withdrawing from his social circles. And he reached out to us saying, is there any support for somebody like myself? And that's when we sort of really started chatting. So, that particular example in place, can you tell us a little bit about what is speech pathology and the sort of people in the community that you help, the conditions that you sort of treat?
Yeah, I think that there is definitely like not so much a misconception about speech pathology in the community, but it's more that people don't realize the extent of our services, I suppose. We work with more than just children with a stutter. We work with elderly people as well who have had strokes, or they may have some sort of like a neurological condition such as Parkinson's or dementia as well. We work with those clients who might have trouble communicating. They have noticed a decline in their communication skills. We can work with clients like that to help keep their communication skills going as they are now, as well as put in any tactics, I suppose you could use, tips and recommendations that can make communication easier in the community. As well as we also work with clients who have swallowing difficulties, which is also something I think a lot of people don't realize that is quite prevalent in the senior community. People who have trouble chewing, people who have noticed that they are coughing when they are eating and drinking because their food and drink is going down the wrong way, I suppose is how you could describe it. We can help with clients who have those issues and altering their diets and changing what they're eating and drinking to fix that.
What you described just then was kind of two different realms, right? There was one which was really around communication and tools around that communication. Then there was a whole other sphere of functional swallowing and the mechanics of that, I suppose.
Yes.
Mm-hmm. I want to sort of split these two worlds up because I'm sure that this is quite new to a lot of our listeners as well. So let's talk about that communication style thing. You guys published a wonderful article which really resonated with the Village Local community a couple of weeks ago. It was on tips for communicating with somebody living with dementia. And it was really around some really great tips and tools for the carer, really, family caregivers or even professional caregivers, in great ways to engage and sustain that engagement. But you also mentioned that you're helping people with Parkinson's and you're helping people with a lot of other chronic conditions better communicate, and their caregivers communicate with them as well. Can you give us a few little examples? Maybe pick a chronic condition and then give us some examples of how a speech therapist or a speech pathologist actually helps these people.
Yeah, so it is definitely very much different per person. So it's very individualized therapy. What a therapist would typically do is go into someone's home, say they have dementia, for example, and we would do an individualized assessment on that client to see exactly where their communication breakdowns lie. Some people might have trouble expressing themselves and putting together a sentence. Some people might have trouble understanding a sentence and following instructions. So every client is presented very differently in terms of any sort of chronic condition, really. So we would go in and find out exactly what's going on with that client, and then we would do activities that target those areas.
Got it. Got
So
it.
say that they have trouble with understanding instructions. They might be able to follow one-step instructions, but when it comes to 2 steps, then they have trouble. So if that was the case, we would then do activities and things with that client to work on that specific deficit. So the activities are usually, I guess you could say, they're spoken activities where the therapist would come in and do practice runs, I guess you could say, practice kind of like homework activities, and then we could leave the carer with homework as well to continue on during the week, because therapy is not something that can be done once a week for 45 minutes. It's something that needs to be worked on every day.
So what you're saying here is it's kind of really a team effort, okay,
Yes,
with the client that you're treating, providing the therapy to, but also supporting and to reinforce that with the family members and other carers as well. What's the impact that this work is having, not only on the care recipient, but those around that person as well? Have you got any examples or,
Yeah, I definitely think that it changes the way a carer can communicate with someone with a condition. They have a better understanding of what might be happening in the brain of the client in terms of their communication skills. So, for example, I serviced an aged care facility, and I noticed one of the nursing staff was telling one of the aged care clients to not bite down on the cup that she was drinking out of. And that wasn't working. So I told her to reframe the instruction by, instead of telling her what you don't want her to do, tell her what you do want her to do. So tell her to put her lips on the cup. And then that kind of resolved the issue, because she wasn't understanding the don't put your teeth, don't bite the cup. But she did understand put your lips on the cup.
Yeah. That's a prime example, right? Where the opportunity, we all fall victim of the situation where, we know our current situation, we know how to best deal with it, right? Those who are in it, but to have that balcony view, somebody on the outside observing and then providing that feedback, I'm sure that is.
Yeah, for sure. And oftentimes it's a very simple change that you just don't really think about when you're in the caring role.
Yeah. No, I'm sure you've got many examples of like that. But considering the impact that you're having in the community and not only to the care recipient, but also the family members as well, what stops people from reaching out and accessing your services in the first place? What are the common ones?
I certainly think the most common is probably lack of knowledge. They probably don't realize a speech pathologist can help their loved one or themselves in terms of, like I said earlier, that they think that we just work with children who might have a lisp or a stutter or something like that, when that's not actually the case. We work, as I said, with all types of communication difficulties. So I think that that's probably the most common. Just community education, I suppose, would be the most common term, most common thing that stops people from accessing our services.
Yeah. And I suppose that's just about education and trying to communicate as much with the community. I know that you guys at Communicate Speech Pathology do a lot of that. You publish a lot of content, a lot of educational material that's not only for those who are experiencing the challenges, but their caregivers as well. So if you haven't checked them out yet, guys, Communicate Speech Pathology. I'll put a link in this video as well. So check out their blog. I know, were you saying that it was a monthly thing or a regular thing that your actual speech therapist publish content? So guys, check that out. Highly recommend it. Give us some practical steps now in terms of how to actually, if somebody's recognizing that, speech therapy, speech pathology would be helpful for my situation. What do I do next? How do I actually get plugged into a service like yours?
Yeah, so you can definitely hop on Google and you can search. There's a governing body called Speech Pathology Australia that governs all of our private practices in Australia. So you can search for a therapist on there. I believe the link is actually called Find a Therapist. Click on that. You can type in your suburb, and then a list of therapists will come up. that service your area. In terms of what we do personally, we do have an intake team. So on our website, there is our phone number. So you can call Sue on our intake line and she will take you through the steps that you need to go through in order to find a therapist with us. Because we are a mobile service, we do cover lots of areas. So we do come to our clients in their homes. So yeah, you can give us a call and we can let you know if we do service your suburb.
No, that's awesome. So put yourself in the shoes of 80-year-old Mrs. Betty Smith, who lives alone. And all the Betty Smiths out there, I'm not targeting you. I'm just using your name as an example. But what do you think? Let's help Betty Smith anticipate some of the challenges that she's going to have in finding that therapist that's nearby. What's the first challenge that you think, or the biggest one that you think she'll have, barrier or challenge to getting there? And I want to sort of, the caveat is, anyone who's listening in, if you do come across these challenges, well, we want to give you some tools to overcome that, because our whole mandate is to prevent people from falling through the cracks in accessing the support that they need, right? So put it back on you, Jess. Can you, I mean, is it a straightforward thing, or can you sort of think about, you know what, this is a common area that people kind of get stuck on? Does that exist?
Yeah, I think that a lot of people assume that they might need a GP referral.
Okay.
That could be an area that they might think that is an extra step that's required, but that's not the case. You can self-refer. Most of our services are accessed online. If you don't have access to the internet, you definitely can ask a family member or a friend who may have access to the internet. Yep. Also, your doctor, your GP, would be able to refer you to a therapist. And then once you actually do get to the therapist, to their phone number, then we are able to post any forms and things that you need to fill out. But most of it is done, or the therapist can even bring the forms with them to your first session. So you don't actually need to access the internet after. And
guys, anybody listening, just remember, right, there are so many people in your local community that are more than willing to be that conduit of getting access to all these digital services, right? You know, friends, families, neighbours, your local pharmacist, Village Local, give us a call. We've got a team of people who can get you plugged in. If you don't have our phone number, 1300 87 43 42, call us up. We'll get you plugged in as well. So don't be suffering in silence, okay? There's a lot of help out there and people willing to hold your hand through it as well. Sorry, Jess.
Yeah, no worries. Also, the benefit of going to your GP is you can access a chronic disease management plan, which gives you a Medicare rebate for 5 sessions. So that Medicare will help you pay for the services as well.
Perfect. So that was my next question, right? So people have finally connected with you. Let's talk a little bit about costs involved and how those costs are covered. So I'd imagine you'd have a private pay cohort and a non-private pay cohort. Break that down for me. What does that look like?
Yeah, so we are an NDIS provider. So if you have any NDIS funding, which I believe is up to the age of 65, so you may be eligible for NDIS funding if you're under the age of 65. We also accept, like I mentioned, chronic disease management referrals, which is from the GP.
Can you tell a little bit about what a chronic disease management plan is?
So that plan is accessed for any allied health provider. So you can also get it for occupational therapy or physiotherapy. That gives you 5 rebated sessions per year, calendar year. So every year you can renew your 5 sessions and Medicare will give you a rebate for whichever allied health professional you choose to use that for.
Got it. So it's pretty much going to your GP saying, hey, look, these are my day-to-day challenges and health challenges, getting some recommendations from your GP as to what would help with those things. Maybe one of those recommendations might be, you know what, Mrs. Smith, you should go and speak to a speech pathologist. And then they may recommend you or refer you into a chronic disease management plan.
Yes, that's it. Absolutely. And usually the GP also has a referral process for the speech pathologist. They usually know somebody in their area.
Right. Gotcha. Okay, so that's Medicare and chronic disease management. Are there any other Medicare subsidies or schemes that people tap into for allied health services?
Not for speech therapy itself. But we also have private health. If you have private health insurance, then you can claim our services through that, as well as DVA.
DVA as well. That's good
Yeah.
to know.
Mm-hmm.
Right. So let's talk about private health insurance first of all. If your plan, the current private health insurance plan that you're on, has allied health covered, in particular speech pathology covered, then it's about what? Speaking to you guys first, having a chat, letting you know what you're covered by.
Yeah, typically you would need to contact your private health insurer to find out what you're covered by. We provide you with a receipt after your services have been paid for, and then you're able to claim that back for your private health.
And does a similar thing work with DVA? I mean, a lot of our viewers and listeners are DVA clients, right? How does it work with DVA?
It does depend on the level that you are covered by.
Yeah.
Look, I would need to look it up, but I believe gold card holders, it covers the whole lot.
Got it. So again, it's about the consumer going back to whoever's providing DVA services or managing their case and saying, hey, you know, I watched this, I read about this fantastic service and I think it'd be really helpful. Can we work that into our care plan?
Yeah.
That perfect. Okay, so now somebody's speaking, or a member of the community is speaking to a speech therapist or a speech pathologist. What can they typically expect from that first session?
Yeah. So from that first session, the therapist is going to get to know you and your background, as well as any medical conditions that you may have, particularly ones that affect your communication ability. From there, they will then be able to plan whether it be an informal assessment, they might, or a formalized assessment. So we have two different kinds of assessment. One is where they, I guess, mark you and then compare you to other people in your age group, versus an informal one where they have a chat and they might ask you some questions that may seem a bit funny, I guess. The ones you're probably not expecting, just to test where you may have difficulties, what areas you may have difficulties with in your communication style.
Got it.
So it is it's supposed to be relaxing. It's not supposed to be something it's not a test. It's just a way that they are able to determine which areas that they can set goals for you in the future and work with you to work towards those goals.
Got it. And I suppose coming out of this first round of consults, a plan is put in place, those goals are sort of set, and then it's really it's about delivering that therapy in one-on-one sessions, and then it's like that take-home homework for those around or within the care network to fulfill on. Is speech pathology, and excuse my ignorance by asking this question, right? Is speech pathology one of those things where it's a start and finish date, or it's an ongoing service or program that's put in place? I'm sure I don't know the answer here, but as I was asking it,
it is every client is different. So it is
I knew you were
not
going to say that, by the way.
It is so hard to answer these specific questions because every client is so different. Every assessment looks different. Every therapy session looks different. But in terms of how long a therapy block goes for, it is usually, particularly working with the senior community, something that is an ongoing thing. But in saying that, you're not locked into anything. So if you're not finding it works for you, then you're able to just stop sessions.
Do you have scenarios where you've really impacted somebody's life? But I'm talking specifically in the aged care sector now, right? Where you've impacted somebody's life, you put them on a path to bettering or overcoming their challenges or managing their challenges, more likely in the cohort we're working with. And then you've given them the tools, and then it's those tools that you've provided is something that they just can continue using to keep themselves on the path. And they might have a check-in with you a year later or 6 months later or something like that. But does that happen as well?
Yeah, so some people, that might be what they like. They might like a couple of sessions with a therapist. We've put in some communication strategies that they can use in the community and at home with their carers. And then they might just like to, like you said, have a checkup once every 6 to 12 months to see if their communication difficulties had changed, whether we might need to implement new strategies. Yeah, it is very client dependent. Everyone is different. And like I said, no one's locked into anything. So someone might want to do once a week sessions, you know, for the next 3 years or so, but they might just want to get something in place now, and that they can use it going forward until they've noticed a change in their communication abilities.
Perfect. Jess, I'm sure you've really opened people's worlds up to, you know, a different opportunity to better somebody's situation, whether that's for themselves or a family member caring for somebody. So thank you for taking the time to speak to our community. And just to repeat, guys, if you want to get in touch with a speech therapist, a speech pathologist, or if you want to get in touch with Communicate Speech Pathology, it's simple. You can either jump online, Google, type it in, find access to the industry body. You can call Village Local. We can get you plugged in as well. I'm going to put the links in this particular YouTube video. But the takeaway message is, do not suffer in silence here. There is help available. Speak to your GP, speak to friends, speak to us, and we can get you plugged in. Okay, Jessie, thank you once again, and congratulations on all the great work you're doing. And look forward to chatting with you soon.
Thank you for having me.
Take care. Bye.
Bye.